Well, welcome everyone. It's my pleasure to welcome you to the question and answer session for Frontier Nursing University. I'm Dr. Audra Cave. I'm the department chair for the Family Nurse Practitioner department, and I am joined tonight with some other faculty. We've got Dr. Sally Weiss. She is course faculty in one of our management courses. Dr. Weiss, if you'd like to say hello.
Hello, everyone. Welcome. I'm glad to see you and that you're interested in coming to Frontier.
Absolutely. And we've got Dr. Nancy Pestle Walsh. She's the clinical director for the FNP program. You see her waving?
Yep. Hello, everybody. Excited for you to be here.
Absolutely. We're also joined by some folks that we couldn't live without that help us make all of this happen. We have a representative from the Clinical Outreach and Placement Department, Katie Graves.
Hello. Hi, everyone. Thanks for joining us.
Yes, and she's going to talk a little bit about clinical placement. And we have Mr. Richard Colkey, who is here tonight to help talk about admissions. So lots of people here to help answer your questions, and we're just going to dive right in. So I've given you the introductions. And this, guys, is a relaxed setting, right? We're going to relax and just talk about our program. So certainly ask any questions that you have. We've got a chat feature if you want to type in questions, or you can just raise your hand and stop me and ask your questions as they come up. So we start a little bit by telling you why we're here. So Frontier, the purpose of our department is to prepare students to become family nurse practitioners in rural and underserved areas. We do this by offering our program in a structured, off-campus, community-based environment. So you'll be able to do your school work in your community and hopefully your clinical as well. We utilize, and what you'll hear a lot about, is something called the culture of caring. That is a foundational thread that is interwoven into everything that we do. We treat each other, we treat our colleagues, we treat students, preceptors within this culture of caring, which embodies respect and professionalism, and really just meeting people and making those relationships count. You will be able to use your community as your classroom, studying from the comforts of your home, and you'll have two opportunities to travel to our beautiful Versailles campus. One of those opportunities is for an orientation session, and another one is a trip to campus just before you go into your clinical practice, where we review skills and get you ready for that clinical setting. So most of it at home, two experiences on campus. And before we go into the nuts and bolts of everything, I want to tell you about some of our achievements. So Frontier has nearly 100 years of experience in graduate nursing education and midwifery education. We have students and alumni from every state. Every 2,500 currently enrolled students and 9,000 graduates. So that's a pretty big number. Frontier has been around for a long time, and we've gotten pretty good at what we do. Some other achievements you can see here on this slide. We've had the National Leader in DEI as a 6-time winner for the Insight into Diversity, Higher Education Excellence and Diversity Award. We've also been named as one of the great colleges to work for in 2021, 22, and 23. The American Association of Colleges of Nurses awarded Frontier the Inclusive Excellence, Belonging, and Sustainability in Nursing Award in 2023. And here recently, Sigma Theta Tau named Frontier an academic honoree for the 2024 Healthy Work Environment. So we're proud of those accomplishments for our university. We were the first FNP program, started off in 1970, recently celebrated our 50th anniversary in 2020. And we have an overall pass rate on the certification exam of 96%, which is well above the national average. And you can see here in this picture That's Dr. Pesta Walsh and myself, and one of our other course faculty, Dr. Diane John. And in the center there is one of our proud graduates. Let's talk a little bit about student support. Frontier is very good at offering support to our students in many, many ways. We have regional clinical faculty. These are your faculty who will be assisting you with not only finding your clinical sites and ensuring that they're appropriate, but also working with you as you go through your clinical practicum. We have academic advisors and clinical advisors. Academic advisors will assist you with getting your program of study or your courses registered and making sure that you're following the recommended timeline. Clinical advisors, and you've already met one, Katie Graves, they will work with you and getting you ready for that clinical practicum. So they'll help you with all of the rules, they'll help you decide if a site is appropriate or not, and then help walk you through that process, including helping you find ways to approach potential preceptors and clinical sites. We have online student mentoring groups, financial aid and scholarships. We have a wonderful library, and then our Office of Diversity, Equity, and Inclusion, which is a big part of our university. Within that office, we have student interest groups, and we have a conference every year called the Diversity Impact Conference, which brings a lot of experts together and discusses ways in which we can improve on diversity, equity, and inclusion. We have scholarships available in the spring and the fall cycles. In 2022, we awarded over $700,000 in scholarships. You do have to have a minimum of 24 credits earned. So typically the scholarships, you've been in at least for a year before you can qualify for scholarships. You do have to have a GPA of 3.25 or higher, and the amounts vary. We have over 20 scholarships available, and again, they're available every spring and fall. Many students benefit from the scholarship program. I'm going to pause for a minute and turn it over to Katie Graves to talk a little bit more about clinical outreach and placement.
Hello, everyone. Thank you for joining us again. My name is Katie Graves, and I am one of the clinical advisors in the clinical outreach and placement. Our unit was formed to help support students within their clinical site search. We help students look for your clinical sites basically and help support you in that search. We do not place you in sites. It is up to you to find your sites and your preceptors and to secure those rotations. One of the beauties about Frontier, though, is if you wanted to take that opportunity and go and stay with Aunt Jane in Mississippi, if you live in California or something, you are able to do that. And we can help you, look for sites there too, wherever you want to go type thing. So just remember, though, it is your responsibility, though, to find your sites, but we are here to support you through that process.
Thank you. And we do really have a large network of preceptors, so we can help you tap into the network that we already have. So we offer 3 degree options for you. We have the MSN, the Master of Science in Nursing. We offer a postgraduate certificate, and that would be for students who already have their APRN in another population. And we also offer the Doctor of Nursing Practice. You're thinking about timelines. We operate on a term system. So we have 4 terms per year, and they're 11-week terms. So we'll go for 11 weeks, we have a 2-week break, and then we pick up the next 11 weeks. So when you think about that, if you're coming for your MSN, then you can plan on it taking about 2 to 3 years, depending on how the rest of your life fits into going to school. A postgraduate certificate is typically a year to a year and a half, and the DNP program post-master's degree is 18 months. That's just a general overview. Obviously, some people can go a little faster and some people may take a little bit longer. I'm going to turn it over to admissions to talk about our admission criteria.
Yes, hello everybody. It's Richard, and my camera's giving me some technical difficulties, so my apologies. But in regard to the FMSN admissions criteria, a student does need to have a RN license current and active, have a bachelor's degree in a field with a 3.0 GPA or above, cumulatively speaking, BSN wise, and then have a good academic standing and prior educational work history, no encumbrances on that RN license, and then have at least 1 year of RN experience as well. And then in relation to the postgraduate certificate, some of the criteria doesn't overlap. So again, to have an RN license with current active RN license in the United States, no encumbrances. And then for the postgraduate certificate, a student does need to have a master's degree or higher, and have a 3.0 GPA or above, cumulatively speaking, and then the degree in the master's level needs to be in an advanced practice registered nurse specialty in one of the following specialties listed. So the current term right now is the fall term, and the application deadline is June 26th. Coursework then does begin October 7th. And then the following term is the winter term, which does open up application-wise on June 27th. And then the application deadline, if winter is a consideration, is September 25th, and then the winter term begins January 6th of 2025. And then the application steps, there is one application itself. Students do submit an essay, a current resume, all official transcripts for all completed nursing degrees. And then there is the portfolio option for students that have are an active RN license and have an associate's in nursing, but do not have a BSN. So a bachelor's in a different discipline. And the last item here, and I'll post this as well, but the tuition, there has been an increase as well. This was just communicated last week. So currently going forward, the current cost per credit hour is $685 opposed to the $665 that was per credit hour.
Your clinical experience, I know a lot of times this section will generate a lot of questions. Both MSN and PGC students are required to get 750 hours in their clinical setting, and your minimum number of hours per week, this is likely to change. The minimum hours at this point is going to be somewhere around 20 to 24 hours a week in the clinic. Really, the idea is that you cannot go to clinic for more than 40 hours a week. So the minimum is set to prevent that. So again, 750 hours, probably around 20 to 24 hours a week. The DNP is 500 clinical hours. Our clinical program is competency-based, and it does include experiences across the lifespan because this is an FNP. So you'll have the opportunity to work with pediatrics and women's health, men's health, geriatrics across the lifespan, taking care of episodic and chronic healthcare needs. And check the chat real quick. That's very good. Richard's got some information in there for you.
Yeah, I'm watching the chat as well.
Okay. So here's to tell you a little bit about who's who and what the support network looks like. I am the department chair for the Family Nurse Practitioner Department. I've been with Frontier for about 13 years. Dr. Nancy Pesta Walsh is the clinical director. She has probably been here for about 14 years. All of our courses are set up with course coordinators and course faculty. So the course coordinators are kind of like the leaders of the course. And then there are course faculty who work in there to help facilitate the course. Once you're in clinical, you will have a regional clinical faculty, and that person is assigned to you to help facilitate your clinical practicum and post your grades. We've talked about the academic and the clinical advisors that help get you ready for clinical, but also help keep you on track with your courses, taking them according to the schedule that we have in place. We have financial aid officers who can help answer your questions as far as financial aid and what that looks like. And then credentialing coordinators who are responsible for making sure that clinical sites, preceptors, and clinical students are all credentialed and ready to get started in the clinical. So you see several pictures on this slide. You've met me and Dr. Pesta Walsh. Down here we have a clinical advisor. We have our librarian. You've met Katie, and then some IT specialists as well. So lots of happy faces to help guide you through your program. And we'll take a minute to talk about our campus. Our campus is in Versailles, Kentucky. It is beautiful. This top picture here is one of the student dorms. You see the little bridge there. We have 3 student dorms right now. When you come on campus, they are single occupancy rooms, and they are equipped with little kitchenettes and bathrooms and just about all of the comforts from home. The top center picture there is what we call this the president's house. So that is where special events might take place, or we may have receptions for students or faculty or donors. Um, the last picture on the top there is our Student Welcome Center. And when you come to campus, that's the first place you'll go. And you'll get guidance and support on what to do next. You'll get schedules and directions for how to get where you need to be. This bottom picture here, you can see the student dorms sort of far away, far back. The bottom center picture is our cafeteria. We have 3 hot meals a day that are prepared by a chef. And then, of course, our sign right here out the front for Frontier Nursing University. So this next slide here, this is our QR code. If you don't mind to take a picture of that and fill out some information for us so that we can get back in touch with you and see if there's any questions that we can answer or give you any additional information. I'll leave that up for just a minute so we can take pictures of that if you'd like to. And while we're doing that, maybe we'll take a minute and ask Doctors Weiss and Pesta Walsh, like, what do you like about being a family nurse practitioner? What's the good stuff?
Dr. Weiss, do you want to go first or do you want me to go first? Go ahead.
No, I'll go. I was going to say, I think for me, it's the opportunity to work with adults and families in helping them achieve their healthcare goals. I work in a specialty practice, so my practice is a little bit different, but it's very challenging. The people I work with have connective tissue disorders, and so it covers a multitude of systems and really challenging on figuring out what is going on with my patients. But most of all, it's the time I can spend with them, teaching them and helping them adapt to the changes that they're going to confront as they go through the remainder of their lives after receiving the diagnosis that they may have. And there's a lot of reward to that. And I think that's what I like most, is that positive feeling of helping somebody and going home at the end of the day and knowing that I actually did touch somebody's life in some way. And so that's why I enjoy being an FNP.
Thank you.
That's a good answer, Dr. Weiss. So for me, it was a little different. I was a nurse for a long time. And, you know, when you're a nurse for a long time, I'm sure some of you guys are too, you see a lot of different providers. And you realize that not all providers are the same. And I knew that as a provider, I could be really, really good at what I do and be a really good provider for somebody else. And so for me, that was the impetus, because we have enough marginal providers out there, and I wanted to be better than what I was seeing. And so that was kind of mine. And then, you know, the variety that I get as a family nurse practitioner. I did family practice for years, and then I made the move to an urgent care. And so I do that in a walk-in clinic. And and then education, and every day looks a little different, which is pleasing to me and the way I like to work. But there's such a variety and there's such a need. And at the end of the day, I really enjoy the role of being the provider and knowing that I'm really good at what I do.
Thank you. And for me, since I'm an FNP too, it's the relationship. It's the relationship that you build with patients and families. I think we all know that as nurses in our nursing roles. That's where it started for me, getting to know patients and families and being able to expand on that. Being able to meet people where they need you is incredibly valuable. It's one of the best parts of the job, or the role, as far as I'm concerned. All right, clinical placement or admissions questions. Does anybody have any questions about either one of these topics? And you can unmute, turn your mic on, just ask your questions.
But hi, my name is Rachel.
Hi, Rachel.
Hi. So I'm, considering going back to school for FNP. But I have a strong background in surgery. I've been an OR nurse for 8 years. I recently just got certified. I love surgery. I love the OR. Just about a year ago, I was given the opportunity to go into leadership. It really wasn't necessarily my thing, but I tried it and it realized it really wasn't my thing. So, so I'm definitely more clinical, but the FNP and surgery though, like those two coming together, like that trajectory,
Mhm.
like where would I find myself with, being an FNP and finding a home in some kind of hybrid kind of setting where it could be like in the office and remain in surgery?
That is a good question. I believe we have students who have been able to make that work with their employer, but you would have to look at state regulations, scope of practice, all of those things. Um, Anybody else?
I do think that that is something that you could merge together. I know that PAs work in surgery quite a bit, sometimes in specialty practices, and or doing, pre-surgical physicals and things like that, or or if you work in a a specialty like orthopedics or cardiology or something like that. But I do know that as an FNP, you could be trained to go into surgery as well, much like you are as an RN, only in a different capacity, maybe as a first assist or something else like that.
Well,
But
we
they can
have,
train you to do that.
yeah, we have surgical PAs, I mean, all throughout the hospital, and we have
Mhm.
some APRNs that come in through private offices
Mhm.
that come and close for the surgeons,
Yep.
but I believe it's moving more towards wanting an acute care NP versus an FNP.
Yeah, that I'm not actually sure of if that is the move for surgical NPs. I don't know. That's a good question.
That is a good question. I don't know the answer to that either. Um, but I think with FNP, that broad scope is always going to be a benefit to getting the FNP, because you can pretty much take FNP and do a lot with it because it's across the lifespan. So I think looking into, if you sound very focused on what you want to do, so looking maybe into the employment opportunities and getting an idea might help you a little bit. I don't know of any national standards that say you have to be acute care to be surgical. Does that
Right.
help?
Mhm. Yeah,
Good.
I'll just have to look more into the Connecticut. How
Yes,
they
yes, yes. I think that's probably a good place to start. And certainly you can, if you stumble upon finding it, you can shoot us an email and we'll see what we can do to help you find your answer. Annie
Thank
had,
you.
you're welcome. Annie had put in the chat that she has some feedback on, I think it's life as an FN or as a APRN, said that she's practicing full scope CNM, but wants to look at FNP so that she can move to more rural areas. And Annie, that speaks straight to our mission at our school is serving the rural and underserved. Many jobs that she sees are in rural areas. And it makes a lot of sense that rural areas want CNMs to also have the FNP skill set because then you can offer just so much more to your patients. That's a good point to make. There was another question in the chat about how many credits are required for FNP and DNP, and thank you, Richard, for answering. The FNP is 52 credits, the DNP is 30 credits currently. Is there a veteran discount or scholarship? I don't know of a discount. I don't know the answer to either one of those, but I can find out for you.
I feel like there may be a scholarship related to that, but that's another really good question.
Thank you for that, Katie. She's got an email address in there for our financial department that can help answer questions about the veteran.
Rachel? Oh, sorry, go ahead.
I had logged off and tried to log back on as myself. I missed, did you guys discuss the 2 times you have to go out to Kentucky?
No, we haven't discussed that, but we can. So there's 2 opportunities to come on campus. Your first one is about 2.5 days, and you come to campus before you ever start your program for an orientation. And at that orientation, we get you registered for your first classes. We introduce you to the different departments like financial aid, IT, clinical outreach and placement, advising. So you'll get to know a little bit more about the school. And we also go through the curriculum and give you a good general overview of what your curriculum will look like. The second trip to campus is something that we call clinical bound, and that's about a 4.5-day trip to campus where we practice skills. You will be taking care of simulated patients, you will be busy, you will be doing assessment skills, and a lot of the skills that you'll need for your clinical placement. And the idea behind that is to have you confident and ready to go when you start your first clinical practicum.
Rachel, I was just trying to look up some of the NP surgical requirements, and I think as an FNP, you certainly can do it. I just found this fellowship at Mayo Clinic that offers a 12-month postgraduate NP or PA general surgery fellowship for surgery to become, so it's a general surgery fellowship. Which sounds like that would be right up your alley once you get your FNP, you know, since you can move to Minnesota, Scottsdale, or Jacksonville, right?
Oh yeah, that'd be perfect with
Yeah.
I'll just have my husband take care of the 3 kids, the house, and
Yes.
yeah,
Yeah.
it'll be fine.
Yeah.
All right, go ahead.
Yeah, sorry. Angela put a comment in there about living in rural Montana. She is in labor and delivery, would love to be a midwife, but because it's rural, doesn't want to limit herself. Can you stay in that field as an FNP? Absolutely. As part of the education, you do get education didactically and clinically in women's health, antepartum, GYN. And so you can work in that area. Now, we do have a women's health nurse practitioner program but I would say, there are FNPs that work in women's health without the WHNP degree. As an FNP, it is a little bit more broad, and so it gives you a little bit more flexibility, particularly when you're in a rural area. Did
Thank you.
that answer your question enough?
Yeah, it did. Thank you.
Okay.
Sharonda asked a question. She has her psych mental health NP, and would she need to take courses over? Richard provided the answer here, so I just want to make sure you saw that, Sharonda. Course content in your previous courses may transfer, typically as long as it covers the lifespan. Then you could request a transfer of those courses. And Jamie asks the question, can you talk about how classes online work through FNU? We have an LMS, which is our platform that we offer our courses on. So you might be familiar with things like Canvas or Blackboard. We utilize Canvas. And so you will access your courses and be able to work through them in your home. It does require study time, so I don't want it to come across as a easy to just fit into your life kind of thing, although it is easier than a lot because you are at home, but there are things that you're responsible for. So typically you'll engage in your coursework from home around your work schedule or however you plan that out. And we have simulation activities where you'll get to participate with your fellow students and work on simulations. We have exams. We have, Dr. Weiss and Dr. Pestawash, what else do we have?
Case studies,
Discussions,
written
case
assignments.
studies.
Yeah.
So it's pretty busy. It's busy and it's active and it's actually pretty engaging. Key point I want to make here is you will not be siloed in your home doing this work. It's not like you come to Frontier, you orient and leave, and we don't talk to you anymore. We're very engaged with students. If you go missing, we will come look for you. We're paying attention. We are committed to your success. So I don't want anyone to feel like you would be working in a silo by yourself in your community without support. Frontier is very engaged. Does that help, Jamie?
Do most students work full time?
Some do, some don't. It's difficult. And it just depends on how you want to do it. So if you want to go to school full time and shorten the amount of time in school, then it's difficult to do that if you're working full time. Many people do, and they do fine. There's just another level of stress to that, as you can imagine. If you're okay with school taking a little bit longer, then working full time could probably fit in more easily. So it depends on your needs. It depends on how you want to do it. There is a good bit of flexibility with Frontier. So either way, it can be done. Just depends on what you want.
And I would say, historically, and not every student, but what those things are that take up your time currently: work, family, whatever it may be. And so when you have those things that take up your time full time, it's advisable to consider doing the part-time program of study, because then that would be 2 courses a term, and sometimes 1 depending upon the program of study, but which is much more doable when you have other commitments. There are students that do this program full-time and they work full-time, but they may also maybe don't have children or a husband or a wife to take care of. They just have, their work hours, and then they can dedicate every other waking moment to study. Each clinic, like if you're full-time in 3 courses, I want to say that somewhere around, what is the conversion, Dr. Cave? Is it 40 hours a week of study, 20 hours per credit or per 3 credit course or something like that. I
I
mean,
can't, yeah, I
there-
can't really quote you the number of
yeah,
hours. But if you come to Frontier and you're admitted, then when you get your program of study, it will give you the recommended study hours. So if you're in 2 courses, depending on what those courses are, it might recommend 30 hours a week of study time, or it might recommend 40 hours a week of study time. It just depends on what you've registered for. However, what I would say about that is it's pretty much on target. So when you see those programs of study and you're looking at what you want to do, if you see that a course requires, I'm just going to pull it out of my hat, 15 hours of study time a week, then that's pretty accurate. So the best advice would be to take a look at that and know that it's not an overestimation. It's pretty accurate how they've marched it out for you.
mhm.
How long does the part-time program take to complete? Let's see. I would say 3 to 4 years. Because typically our part-time program of study is taking 1 course at a time.
Is it 1 or 2 courses?
I believe it's 1. And in
We
some
have-
some terms it might be 2.
I think we do have the program of studies available. It is doable. When I'm a graduate of Frontier from 2008, and when I started this program, I had 4 children at home, 3 littles and a little bit of older one, but 4 kids at home. And I worked maybe 2 days a week, and I did the program part-time. So that's just a real life example. I did, and so all of my waking time was spent on homework or my children, right? Except for 2 days a week, I would work outside the home as a nurse. And so it is doable. I can tell you that I did 1 term of 3 classes, and I decided I would never do that to myself again because of my other time commitments, because I liked my children and my husband, at the time. No, I still like them, but, like, if you have things that you like to do for self-care, for, work, for your life, and you can't fit that, whatever recommended for a full-time program of study is, I would recommend, slowing down just a bit. Because, ultimately the goal is to get done and to get done successfully and know what you need to know, not a race to get done quickly. Right? Because you want to, as a student, you want to take in the moment, your opportunity to learn as much as you can about this new role, so that you can become the best provider you can be. And so it's not a race to get to the end. It's what can you do to really learn the information and keep the information so that you can carry it forward, and it scaffolds on to the next course and the next course. And then it, you finally put it into practice when you get into clinical. So you have to be a good independent learner. So you have to be willing to get up and turn on your computer and go to work and do your homework and study for tests and things like that. If you are, and knowing what your learning style is really important. So we have a variety of different ways we can present the information. Some of it is reading, right? Reading textbooks and things. There are some videos in some courses for those audio learners. But if you know that you are a lecture learner, you need someone to read you this information, then you may need to consider a different program, because not all of that information is presented that way. We present a lot of information like that, but not all of it is. So knowing what your learning style is really important as well. And you have to be motivated to learn. And, we want motivated, engaged learners, because this is the best program. I 100% believe that it's the best program. And we will prepare you to become solid nurse practitioners. That is the ultimate goal. But within that, from between here and there, it's a lot of work. And it's difficult because you have other commitments that take up your time. And it's tough to get from A to Z. But if you can make it through to Z, it is totally worth it. And it's a
Right.
good program.
It is a good program. 96% pass rate.
Which is outstanding.
Far above the national average. So Angelica asks, how competitive is the admissions process? Is there a limited amount of students admitted each session? Yes, we admit, I believe our goal is around 60, 65 students per term.
In your admissions application, part of that will be your resume. And so having a complete resume with your volunteer experience, your any publications or things like that that you might have, your work experience on there. What else is important? Your education experience, obviously, your work experience, volunteerism, any organizations that you're a member of, certifications that you may have, CPR, ACLS, things like that. All of those count in that admission process, and it's a rolling admission. And so, when that admission information was presented, you can see that the fall term applications are not due are due in June. For fall term, that starts in October. And so for an October start. And so that's a quick turnaround time frame. So they're constantly reviewing applications, and there's a winter and a spring and a summer. So there's 4 admission cycles a year. And so let's see, how many are admitted into each class? Do we have a hard number on that, Dr. Cave?
Typically we do. So our goal is 65-ish, somewhere around there. And
Natasha asked if that's just FNP students.
it is.
And yes, that's FNP students.
Yes.
Each term.
And Rosalie has posted in the chat box the programs of study. So you can click on that link and take a look at that. That's the document I was talking about that has both the credit hours and the recommended study hours, if you want to take a look at that. And another thing I wanted to touch on while we were talking about working and school and work-life balance is, as you're thinking about this and making your plans, do consider that working full-time while you're in clinical will most likely be a challenge. I want you to think about that really hard, because for FNPs and for this program in particular, we are doing outpatient clinicals. We're not acute care, so we're not doing inpatient clinicals. And that means that your clinical opportunity is going to be mostly Monday through Friday, 8 to 5. So think about that while you're making your decision. We want you here at Frontier. We want to produce nurse practitioners across the country, and we welcome you with open arms. But that can sometimes be a challenge. So do think about that as you're making your plans and where you want to go to school. Thank you, Richard, for posting the course transfer policy. You can click on that if you have MSN courses and are interested in applying for transfer. You can find the rules there. And Katie asked how many students are in each class. And Natasha, I see your hand up. I'm going to get to you in just a minute. Katie, that depends on the class. So our core classes are going to be things like health promotion and pathophysiology, pharmacology, and physical assessment. And so students from every program are in those classes. So those classes might be 200, 250 plus students all in that class. Once you get down to the FNP management classes, so that'll be things like primary care 1, 2, and 3, pediatrics, women's health, it gets a little smaller. So probably 60 to 75 students in those courses. Does that help, Katie?
The other issue is when you're in the larger courses, there's more faculty, so there's a ratio of the number of students to faculty, which is very small in comparison. So if you're in a class of 200 and the class is very active with interactive assignments, the ratio may be one faculty member to about 30 students, which is an average classroom that you would even think of if you were ground-based. So we make sure that there's enough faculty available to meet student needs and always available to you. If you need to meet with somebody, talk to somebody, there's always faculty assigned to you. Does that help answer that?
Yes, thanks. I was just wondering because I know there's several different times throughout the year that you can apply. So in my head, I was just kind of wondering, is it like you kind of follow along with the same cohort, but you kind of can't if there's different people are going at different paced speeds as well. So I was just kind of wondering how
Right.
that works. How many
Well,
students?
you're right on track there because a lot of students do travel through with their cohort. Some don't. If they slow
Okay.
down or they speed up, they may not. But in general, you will start the program and likely end the program with some of the same people, and you will meet some of your best friends.
Nice.
Yep.
We see that a lot in clinical bound. A lot of bonding goes on in clinical
Right.
bound when you come to campus right before you go into your clinical settings.
Natasha, I had seen your hand up. Do you have a question?
Yes, I do. I had a question. I've already applied to the program, but I had
Thank you.
inquiries about, I have I had about 10 years of LPN experience, but I did not include that on my resume. And I was wondering, should I have, because I did have a lot of LPN experience, I include just mainly my RN experience. So I was wondering, should that have been put on there?
The admission criteria is your RN experience.
Right.
So
Okay.
that's what they will look at. They also do look at CVs though. So I don't know if there's a way to retract that and add your LPN experience because I know that was very valuable in shaping the kind of nurse that you are. But as far as admission criteria and meeting the rules, it's RN experience.
Yeah, and that was for my resume. I included just majority of my RN experience.
Okay.
Some of the LPN did overlap, but after I submitted, I was like, a lot of my LPN experience did
Sure. I'm
shape
sure
my
it is.
RN experience.
Absolutely.
So I was wondering,
Absolutely.
okay, all
Thank
right,
you.
thanks.
Oh, Ariana, that's a great question. At the clinical bound experience, is there a white coat ceremony? We don't necessarily have a I'm sorry, Rachel. that just sorry, Rachel. The clinical bound experience, we do have some celebratory things. So we have a celebratory dinner and a reception, and we introduce you to frontier traditions at Frontier Bound that carry through at Clinical Bound, but we don't have a formal white coat ceremony. These are great questions. Thank you. Thank you for asking them. And I love this picture here. This is one of our faculty, Dr. Tarika Fuller. She'll meet her at your clinical bound experience. And she is pinning one of our recent graduates. And the quote is, "Success doesn't come to you. You have to go to it." And we are going to be right there beside you, supporting you along the way. And then there's some email addresses here if you have any additional questions, whether it be admissions questions, clinical advising, or financial aid. You can reach out to those folks at those emails.
Rachel has another question. Other expenses anticipated beyond the tuition?
I'm going to advise you to email financial aid to get a good answer to that question. But yes, we do have fees, like there's a technology fee and there will be a clinical bound fee and that sort of thing. I still think that overall Frontier is a very affordable program when you're looking at some of the others. But as most universities, there will be fees that are adjusted for different things. But that is a very good question. And then Ashley has her hand raised.
She has one more question in there too. Do we stay on campus during the 2 times you go to for Frontier Bound and Clinical Bound? You can stay on campus. You may opt to stay off campus if you prefer. But if you stay off campus, you're on your own for housing in terms of paying for a hotel. If you stay on campus, that's part of that clinical bound fee.
Richard has posted a link here for additional fees and tuition. Ashley.
Hey, sorry, this might be a question for financial aid, but I was just wondering how, if we're not doing like a financial aid, or like if we're paying out of pocket, say, do you know how we pay for that? Is it like semesterly, or do you pay it the whole thing at once? Like, how does that work? Or I can email.
You're fine. It would be quarterly. So each term, based on what you've registered for, you will get your invoice, and it's per term.
Okay, and it's per class that you're taking. It's not
Yes.
like a lump sum. Okay, awesome.
Per credit hour that you register for, plus whatever fees. Yeah.
Got it. Okay, thank you.
You're welcome. Great questions. I'm not seeing any other hands up. Let's see. Leah says, is it possible to do in the clinical in a state where you have no license? No, you have to have a license to do your clinical. But it's good that you're thinking about that now, because if you choose to come to Frontier, then you can make that happen. But yes, you have to have an RN license to do your clinicals. Now, if you're in a compact state, then that helps, right? Because compact state.
Sorry, I didn't mean that. You had said earlier for clinicals, we could go anywhere to any state. I have an RN and APN license, but how is it possible, like, for me to do clinical in California if I don't have a California license?
No.
Right. It would either have to be a compact state, and you would have to have a compact license, or you would have to get an RN license in California. And I don't believe California is a compact state.
They are not.
No, I misunderstood at the very beginning. I thought you said that our clinicals don't have to be in our home state. I just misunderstood them.
It does not have to be in your home state.
But it has to be where you have a license.
Exactly.
Yes, that's it. Okay. All right. Thank you.
You're very welcome.
But I would say we do have students that travel to do clinicals in other places for whatever reason, because they grew up in a different place, or they have family there, or a friend there that they can stay with. But it's not always that they're just staying home to do clinical. Sometimes they do travel, but yes, you have to just make sure you cover the licensure in that state if you're not compact. But the good news is we have 41 compact states, so that's good.
So we have just a few more minutes left for any additional questions that you've thought of. This is another really favorite picture of mine of celebrating our graduates and talking about resilience, which I think we've all had to face over the most recent years. We adapt in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And that just defines nursing, I think. We adapt, period. Thank you all for being here. It means a lot to us that you are interested. We hope that we've been able to answer your questions sufficiently. And if you think about it and you come up with something else, please shoot us an email. We're happy to talk to you about our program.